Welcome, and thank you for joining us today for Perspectives on Early Stage Alzheimer's, part of our Breaking Barriers in Alzheimer's Disease series. I am Irene Ninye, Chief Science Officer of the Society for Women's Health Research. SWHR is a national nonprofit dedicated to advancing women's health through science, policy, and education while promoting research on sex differences to optimize women's health. For those of you who are active on social media, SWHR will be tweeting during this event and invite you to use the hashtag SWHR Talks Alzheimer's on all social media. Alzheimer's disease is the most common form of dementia among adults aged 65 and older. And studies have shown that there are sex-specific underpinnings of this progressive neurological disease that disproportionately affect women, and especially women of color. Of the estimated 6.7 million adults in the United States living with Alzheimer's disease, almost two-thirds are women. Alzheimer's is characterized into three broad phases: preclinical Alzheimer's disease, mild cognitive impairment, and dementia. There is currently no cure for Alzheimer's at any stage. Researchers are continuing to investigate more cost-effective and non-invasive approaches for diagnosing Alzheimer's disease and related dementias because early diagnosis is essential for slowing its progression, planning for long-term management and care, and maintaining quality of life for both patients and their caregivers. SWHR's Breaking Barriers in Alzheimer's Disease series aims to share the experiences of women with Alzheimer's and highlight the importance of innovative diagnostics and equitable access to them for women and other individuals affected throughout the diagnostic journey. I would like to take this time to thank the sponsor of today's event, Eli Lilly and Company. SWHR maintains editorial control and independence over our program development, content, and work products. During today's fireside chat, we have the privilege of getting a first-hand glimpse into the experience of someone who has received a diagnosis indicating she has early onset Alzheimer's and is willing to share her journey living with this progressive disease. I am pleased to introduce Jacqueline Torfin. Jackie has worked in biotech industry and academia with a focus on medical technology and regulatory sciences. She is CEO and principal advisor at the consulting firm Culier Advisors. Jackie is a career woman, a wife, a mother of 6 children, a grandmother of 6, and she also has 2 dogs. So at this time, Jackie, please turn on your camera. We welcome you to the stage. And so while she's doing that, I want to take a quick moment to note that we do have some topics that we've prepared to cover today, but those of you who are tuned in live are invited to submit questions throughout the event. You can do that using the Q&A function at the bottom of your screen, and we'll try to address as many individual questions as we can during the program. But we also may combine some that have recurring themes or broader applicability to our audience. So welcome, Jackie. We are so glad to have you with us and are excited about this conversation.
Thanks, so am I.
And so, Jackie, you were diagnosed, correct, in 2022, so it's been about 2 years. And, you're looking at you look great. You look great. And you're not over, I know we don't often reveal our age, but we know you're not over 65. What led you to pursue and receive this diagnosis?
No, I'll be honest, I'm 57. So I'm very young. So I decided to pursue it because about 23 years ago, I had a car accident and I had a brain injury. And after that brain injury, I had occupational therapy and I became very, I guess, sensitive to changes in the way that I was speaking or my ability to have recall of words, because those were my primary issues after my brain injury. And so over the years, it became kind of a family joke. I would forget the names of things, or I still never call a napkin a napkin. I always, if there's a lot of chaos, I'll be like, and everyone in my family will go, yeah, the wipey thing. Exactly. So at the end of 2022, I forget the timing, 2022, I think, middle of 2022, I started noticing that actually it started showing up first I was missing appointments. missing work appointments. I was blowing through my calendar and people would be messaging me like, are you showing up? Or that's not me at all. I'm very on top of my work. And my husband started noticing I was being more forgetful. I couldn't find my wallet once and it was in our closet. I mean, just really crazy, weird things. And um, kind of let it go a little bit. And then at the end of 2022, it started to become pretty severe, is what my kids and my husband said, as far as like being very forgetful. And so I kind of mentioned it low key to my primary physician, who said, oh, so you're having memory issues. I'm like, no, I'm not having memory issues. Cut to the chase. I went to a neurologist and they said, I was very lucky. I am not like most people. I had testing from when I had my brain injury 23 years ago. So I was able to repeat the same testing and they were able to show that I had a deficit that was not related to my brain injury. It was a different deficit. And then my neurologist said, well, you're very young. I was 55 at the time, I believe, maybe 56. And he said, let's come back in a year and we'll do more testing and we'll see what happens. And I said, yeah, no, what? What? I can't, I'm not functioning very well. And like, I have children, I need to go home and tell them to either start procreating now so that I know who my grandkids are, or, I have to figure this out. I can't just like go along my merry way. And so I got referred to the Mayo Clinic, had some testing. So the first thing that really bothered me there was that I had to push. Like, why was the first response, it come back in a year? It was like, I'm young enough that I can try and figure this out, right? And that was disturbing to me. And then I went to Mayo and I had to continue to push to get testing. Most of it not covered by insurance, out of pocket, but I was really determined to figure out if this was, what was this? Was it, I was diagnosed with mild cognitive impairment, which is not dementia. It's before dementia, but it's still not normal for someone who was my age to have that deficit. And I wasn't going to take the answer of must be menopause, because frankly, I had been through menopause. Like, I went through it early. It's like, it's not menopause. It's just you're aging. I'm like, I'm 56. I'm not aging. Like, that, it didn't make sense. So I just kept pushing. And I'm really glad I did. When I did get the diagnosis, though, I have to say I was disappointed in the response. The response was, here is a brochure and we have some support groups. So
So I want to kind of dive in a bit on a couple pieces. Well, the first one you said you had various tests and you had some baseline. What tests and screens did you do this time around?
So I started with the neuropsychological testing, which is delightful. It's like an entire day of different tests, different word tests, math tests. It's like an SAT for adults in one day, and you feel, I mean, to me, being a high achiever and kind of smart, I always feel like I'm failing, right? Because I'm not remembering something, or it's actually really, it's an extremely emotional day. I'm just thinking I have one coming up in June and I'm already freaking out about it because it's hard because you don't feel smart, you don't feel good about it. And it's just it's tough. But so I went through that first. I had several MRIs. Ultimately, I pushed for a PET scan where you drink a substance and um, it's really the diagnostic, the first diagnostic for it's very expensive, which is why they don't do it. So you drink something and it's glucose, and the glucose gets um, taken up by the cells in your brain. And then they do a PET scan to determine is your brain taking up the glucose in the right way or too much or not enough. And that's by looking at the patterns of the PET scan, they can detect whether it's um, an issue in your brain. And there's certain patterns that are indicative of different types of dementia. And then after that, I had a spinal tap to look for tau proteins. And I was excited to see just recently, like in the last week, there were a couple of diagnostic companies that have gotten approval for blood tests for tau proteins. I haven't done enough research to see if those are great or not, but that
They
was
picked the,
exciting.
they picked the wrong one to mess with Alzheimer's because as you can see, everybody, and she knows what she's talking about. You have great explanations. I really appreciate how you're breaking this down
Yeah.
from your perspective of, understanding what these tests involve, and even how you said it goes from the screening to these more invasive, like you mentioned, the spinal tap, and that's a very invasive procedure, and bringing, you've highlighted the idea of like these blood tests and some of these other non-invasive tests that are
Yeah.
really important to, we work at SWHR in promoting that investment in the research so that we can
Yeah.
have
Because if
other
you can do a blood
diagnostic
test, just like PSA, right? Prostate cancer, that was a
tests.
game changer for prostate cancer. Now you can follow the PSA over time, and then they can do more diagnostics to determine whether it's cancer or not, right? But they don't have to do a biopsy until it goes high. If we could do that with a tau protein in your blood, and they don't have to do a PET scan or something more invasive until they see a pattern, that's amazing. And you
Yeah.
can do that in younger people. Like for me, I could change a lot in my life to make this not be as big of a deal.
And even as you mentioned that, not being a big deal, how do you manage that, right? There's so many different approaches to addressing, particularly at work. You talked about meetings, and you weren't performing the way that you felt comfortable and the way that you were used to, you
Yeah.
know, you having to balance health and work. And, tell us, like, did you tell your colleagues about your Alzheimer's? What did you process through? Like, what were the considerations? Do I say something? Do I not say something? How much do I divulge? Or, can I say, did you even feel comfortable saying something?
Yeah. So the first 6 months was really hard. It was hard for my family to process it. And I think for me too, I mean, for me, I was like, oh my God, I'm going to die and this is horrible. And I'm, like, I wasn't always the funniest or the prettiest or any of that in the room, but I was usually the smartest. Right. And so now I'm like, well, now I'm not going to be anymore. I'm going to have dementia and I'm going to be like, it's going to be awful. So like I had to go through this whole identity thing of like, who am I now? And if I'm not my brain and my job, what do I do? So I figured that out, even though I'm a little emotional. Um, and then because I'm a scientist, I did all the research and I wasn't getting answers. So I have like 6 books and I read all the books and I did all the research and I went to Cleveland Clinic and met with a special doctor to just get more information. And um, then I started to feel like comfortable with the fact that this isn't a death sentence. I mean, you started this conversation with some facts that are true facts, but I I'm not recognizing those facts at this point because I think we're in a place right now scientifically that so much can happen. I'm young, I'm super early in this disease. Um, I've already noticed by making some behavioral changes in my life that I have the last year that I went for my update, I was completely stable. I expect the same this year, right? I'm not better, but I'm not worse. I'm good with that. I'm good with not being better or worse, and I expect that for 10 years at least, right? I can do this. And some of the behavioral changes where I don't eat sugar, well, I have a little bit. Um, but it's kind of like, I was thinking about this. It's kind of like, you know how everybody tells you that clutter in your in your house is really bad for you, and we try to keep a tidy house, and every day I'm tidying up, but then you have a week that's really chaotic and you kind of let it go. That's how I feel about my brain health. I'm trying to keep it uncluttered. I'm eating well. I changed my diet. I'm sleeping. I'm exercising a lot. I don't drink alcohol much, a little bit of wine. I do. I'm not going to lie. Um, but then I go on a vacation. And for that week, it's like my cluttered house. I kind of let it go and everything. What's really interesting is I can tell. I can tell when I've had a week that I'm completely off. I'm not thinking clearly. I do forget more. Um, it's not okay. So that's how I know that the behaviors that I have now are super powerful to keeping me on track and stable and not making it worse. So that's pretty cool. And I'm like the evangelist about sugar, and I won't give my grandkids sugar. And I'm like that mean grandma now. I'm like, here's a here's a treat, but it's not it's not candy. Yeah.
And I think that's so interesting because it can be hard. We often get um, recommendations, diagnoses, treatment plans that cause major lifestyle changes. And you saying how, making those aggressive changes to your lifestyle can be hard to stick to. But you're saying you can actually notice in a span of as short of a week that
Mhm.
there are differences
I
in
can, and that's why it's easier to stick to.
Mhm.
So I couldn't tell in the beginning, but once my body got to like a set point, I think that's how I feel. Like once I kind of got all the things out of my body and I got to more of a set point, now I can tell pretty much after a week that I'm not good. Actually, like I can tell the next day if I've had a lot of sugar. I can feel it.
I love how this kind of comes back to knowing your body and
Hmm.
that it's your baseline.
Hmm.
And so it's not the same for everybody, but as you learn, and it's so important for everyone, not even just women, to understand and know their body so that when something changes, you know when you're off.
Yeah.
And
And that,
then,
yeah. And I think that's really critical. It's not the same for everybody. The cause of Alzheimer's is not the same for everybody. I I feel like we don't know everything that we need to know about Alzheimer's, right? That's why your organization is so important to me. But Alzheimer's today is like the cancer of 50 years ago. Cancer, big. Everybody, you have cancer, and not everybody knew exactly why it was happening or all the reasons. I feel like that's how Alzheimer's is today. Alzheimer's is this big thing. We don't know exactly. There are several different things that could be causing these changes in your brain, different triggers for different people. And I feel like 25 years from now, we're going to have so much more information about the things that can create 25 years in your future, these issues in your brain. Right. So I think that's important. Brain health is important from when you're very small up through that, because the things that you're doing when you're younger are what is affecting whether you're going to have some sort of a brain situation in the future.
And I want us to, you talked about it earlier, there's so much, right? And I was like, I'm trying to figure out where to go next. And um, you talked about coverage, right, and access. And so, and I know even when we had spoken before, you mentioned navigating serious obstacles with insurance coverage. There's
Mm,
finances, disability, and that's just, the surface, touching the surface of
yeah,
topics.
yeah,
But what might you say was your, I guess, greatest challenge, either getting or sustaining care for
yeah,
your health? And I even use the word health as opposed to
yeah,
managing your disease because it's bigger than just Alzheimer's. You've talked about all the lifestyle and brain health and, making sure that your overall well-being supports that. And so maybe you can kind of talk about how did you access and
yeah.
care?
So this kind of goes back to one of your original questions when I got off track. Funny that I got off track. Um, how did I handle releasing the diagnosis? And now I talk about it. I put it on my LinkedIn. I put it in my social media. I'm not afraid of it anymore. But one of the reasons I was afraid of it in the beginning, one of the serious reasons was I still need to work because there is it's expensive. Um, I had a lot of out of pocket expenses. We just actually finished that, paying that off after 2 years. Um, I mean, like over $30,000 of testing and things. I'm very lucky. I have the ability to make money and to pay that stuff off, right? But I have to keep working. And so I was afraid to let it out because, hello, I'm a consultant. Who wants to who wants to work with a consultant who isn't smart? Okay, well, Alzheimer's doesn't make me not smart. It makes me sometimes forget a few things. It doesn't make me forget what I know, by the way. It makes me forgetful. There's a big difference between intelligence and having mild cognitive impairment. And that's
Can you
super
just say
important.
that again? I just wanted to hear that again.
Yeah, there's a big difference between intelligence and having an impairment in your brain. Big difference. And I think that is not known. And it was scary for me to let that out because I need to work. I need the money. I can't not work because, well, first of all, I'm self-employed. So I have to fund my own insurance. Um, when I first got the diagnosis, we very seriously considered, and in fact, my whole family was like, you have to stop working. You need to focus on this. You need to get better. You need to be here for your family. And we thought about it. And then I looked at it, and financially, that can't work. It just can't work. Looked at insurance. How am I going to fund insurance? I can't. I'm too young. I'm too young to get Social Security. There's no option for me. And in order to get Social Security or Medicaid, I would need to be considered disabled. Well, guess what? I'm not full on dementia, so I can't be qualified for disability. So I'm in this weird spot where I'm too young to qualify for any kind of aid or support, but I have to put a very significant amount of time and effort into staying healthy, which sometimes doesn't correspond to working. Like my job takes me on a lot of trips. When I'm traveling so much, that's a situation. That's hard, right? So sometimes I get confused in an airport now because big crowds, that's another one of my symptoms, social interactions and sometimes big crowds, or if there's a lot of activity, I kind of get, I don't know, I can't explain it. It's not like I get scared, but all of a sudden something happens and sometimes I lose where I am. Sometimes I feel like super overwhelmed and I start getting really anxious. That's not normal for me. I've always been, I mean, I have traveled the world myself multiple times before a few years ago, and it was no issue. And it's a little different now. So, yeah.
Wow. This is I feel like we could keep going so much longer, and thank you so much for
Yeah.
sharing. And as we're before we wrap up, I did want to ask you one last question. You know, we have a diverse audience of individuals that attend our webinars, from patients and general audiences. We have researchers and healthcare providers, industry, and even policymakers that tune in. And so we recognize that every person's experience is unique in their own. Um, in exhibiting symptoms for a disease that has no cure can be scary. From your personal perspective, um, what did it mean to you to have an early stage diagnosis, um, versus finding out later?
Oh, wow. It gave me a lot of ability to control, to feel like, well, you can't control, but to feel like I can make serious modifications in my lifestyle that can absolutely impact the way that I feel and the way this disease progresses. We know that from the research. We know that for sure. And if I wouldn't have been able to get this diagnosis for another 5 years, there's a difference between being handed a pamphlet and said and being told you should just eat well versus understanding and feeling it for yourself. And I was able to get really into this and understand it. And now I see the impact. I feel the impact, which means I'm not letting this lifestyle go. It's not just a passing fancy, right? And I
Mhm.
think that people can benefit like a huge amount. It allowed me to make sure that I got all my affairs in orders, even though I kind of had it. Luckily I had long-term care insurance already. My sister sells that. And so she's been an evangelist. It's kind of weird that we had that connection, right? So I had long-term care insurance, but I was able to um, double check our policy, make sure everything was in order there. I feel super confident that, and I'm very young to have all that stuff kind of taken care of, right? Now I can focus on my family, my friends, staying healthy. It's a very different, and I feel like I have the ability, it's probably crazy and I probably don't, but I feel like I have the ability to turn this around. And
And
nobody can tell me that I can't yet.
and I think you've really put it in words that I think will resonate with a lot of individuals in finding, you know, whether it's Alzheimer's or some other condition that they might have or a health challenge, finding your place of peace and wellness in that.
Yeah.
Even if it's not, um, if there's no cure, you can still find wellness, and that journey is invaluable. Thank you so much, Jackie, for, you know, just being so transparent, for being here today. We definitely wish you well in your journey, and we'll be keeping in touch. And we also would like to thank Eli Lilly and Company for their support of this event and SWHR's Alzheimer's program. We will continue the conversation with hashtag SWHR Talks Alzheimer's in our work to promote research to better understand, diagnose, and treat Alzheimer's in women. Our next event in the Breaking Barriers in Alzheimer's Disease series will focus on innovations in diagnostics and screening tools. And we will hold that in June in recognition of Alzheimer's and Brain Awareness Month. Alzheimer's disease is also one of our focus areas for a Women's Health Dashboard. Through this platform, you can explore the latest national and state data on diseases and health conditions that have significant impacts on women's health across the lifespan, including public health data, research investment in progress, health insurance coverage, and relevant policy implications and actions. You can learn more about SWHR's advocacy work and future plans in the Alzheimer's disease space through our call to action report, Advancing Care in Women with Alzheimer's Disease, and our policy agenda, Breaking Down the Burden of Alzheimer's Disease for Women. Please connect with SWHR on our website, www.swhr.org, as well as on social media to register for future events, download women's health resources, and sign up for our newsletter. We will send out an email with a recording of today's webinar to all the registrants, as well as post the recording on the event's webpage for future viewing. So please be on the lookout for that and feel free to share with others far and wide as we continue the conversation. Hashtag SWHR Talks Alzheimer's. Thank you for joining us today.